Victoria Bundy. I've got a little boy, Ewan, who's 5 years old. He happens to have Down syndrome. My partner Andy, and we're going to be talking today about my pregnancy and my experience of postpartum psychosis and what happened to me and my family during that time.
Hi, my name's Lucy. I have 3 children, Miley who is 6, Esme who is 3 and Arlo who is 8 months. And I'm going to be talking about my experience of postpartum psychosis.
I went in to hospital to have a caesarean section at 37 weeks, and I'd had quite a, I wouldn't say traumatic, but my pregnancy, I had quite severe pregnancy sickness. So I was in quite a poor physical and mental state of health when I went in, and I was given morphine for the pain of my caesarean soon after. And I remember laying back, putting my head on the pillow and sort of looking around and thinking something's not quite right here. It's like I was in a dream and I was watching everything happening to me like it was happening to someone else, and I was like looking in mirrors and pinching myself thinking, am I really here? What's going on? And I knew something wasn't right, and all my family, they were thinking the same, really.
I think I first probably realised, it was probably about 4 days after I had Miley. I remember saying to my mum, I don't feel right, something's not right in my head, I think I've got postnatal depression or something. But there was already a lot of things that had happened since having Miley that people had noticed things that weren't right. When I was in Trelisk, a couple of them, a midwife had raised concerns with the psychiatric people on the ward, and they came to assess me because I was not able to sleep, and I had a really traumatic delivery which resulted in blood transfusion. I had a preeclampsia, and I was unable to sleep, so they were aware of things by looking at me that I didn't seem right. Well, I was discharged from Trelisk, which was 4 days after having Miley, so then I was just sent home, really. But I continued to just become more and more unwell. I was confused. I would go around the house saying I'm going mad, and then I'd be saying I'm dying. I was just totally all over the place. So my partner took me to the doctors on the Friday, the day after I came out of Trelisk, because I wanted to get some sleeping tablets because I was still unable to sleep. They tried everything. I had relaxing music they played, they were getting massage oils just to try and get me to sleep, but I just couldn't switch off. So I went to the doctors, and he wasn't going to prescribe me anything because he knew that I wanted to breastfeed, so he didn't want to do that. So I left with nothing, no help of information, nothing. Went back home, and again just continued to just keep getting worse and worse. So that evening there was Kernow docs were called. They came out. I can't even remember seeing one of them. I think there was a couple that came out, and they I don't know if I was possibly prescribed something. I couldn't really tell you, but maybe. But again, they didn't know what to do with me or what was going on. So they left, and it just continued to just keep, it was just getting worse all the time. So it got to the point where I was being locked in the house because I was trying to leave the house and with just a night dress on. So obviously they had to lock the doors. Everything had to be put out of reach, anything dangerous, because they didn't know what I was going to do next. So Mum in the end called upon her friend, who was a retired mental health nurse, who came out to see me at 2 o'clock in the morning just to see what she could do. And friend came out, and she then made all the phone calls, and she was able to then there was a couple of social workers that came out to assess me at home, and then it was decided that I needed to go into Bodmin. So my family took me into Bodmin, and then I was where I was for 18 days. So I was section 3.
I'd become very anxious, and I was depressed, and I was having I was being seen by the mental health team at Trellisk. I'd gone down to Truro. I'd also been admitted to hospital 3 times due to my sickness and my sort of state of mind. And it was quite apparent that when I was speaking to my family, when we'd go into hospital, the nurses and like sort of the midwives on the ward where I was taken, because I was actually taken onto the ward where parents were delivering their babies, and I was there just wanting someone to take the baby out because I couldn't go on. It was awful. And it was a lot of sort of, oh, that she's back on this, you know, and it was like turned heads, and it's like nobody knew what to do with me. And I just wanted to say to someone that I wanted to just go and lie in a bed and given some drugs, so if I could just like go to sleep until it was time to have the baby. That's really how I felt. So luckily we got booked in for a cesarean 3 weeks before my baby was due, and so we thought it was all going to be sort of plain sailing after that. But my sickness just sort of continued in hospital afterwards, so I was hoping it was going to stop, but it didn't. So that sort of added to my poor mental state in hospital. I was visited by the mental health team in hospital, and we seemed to be being asked the same sort of textbooks questions, and luckily my partner was there most of the time when the questions were being asked, because I wasn't really aware of what was going on. I can't remember being asked any questions. And then they noted that I was confused and anxious, tearful. At some points I didn't even know if I'd had the baby or not. And they all knew something was wrong, but the day when I was assessed to go home, they said, well, I remember touching the man's arm and saying, are you really there? I didn't even know if he was really there or not, and surely that should have triggered some sort of warning signs. All the staff were seeing me like that, but I was sent home, and that was sort of by late afternoon. And then I got home and I knew something wasn't right then, and I went to bed, and in the morning I woke up and I just knew something was really wrong, and I was looking around the room, and I had my camera out. I was going around the house looking through the screen, because I knew that didn't lie. So I was looking at everything, and I was frantically phoning my dad. And I was scared of something was going to happen, but I didn't know what. And I was hearing things and seeing things, and my family didn't know what to do. I was trying to phone the police, everything. And then they called the local midwife, the head midwife out from the local hospital, which I'd been in to see before. She came out to speak to me, and I remember just sort of looking at her vacantly, and I couldn't speak, and it was like I was underwater. I could hear what she was saying, but I just couldn't answer her questions, and I was sort of looking like this. I think she sort of knew something was wrong, but I don't know if she knew it was psychosis or not. She couldn't get anybody out, and my partner was frantically trying to make phone calls. And then it got to about 7 o'clock in the evening when my father-in-law came home, and he rang the hospital, local hospital, and said, if something isn't done, and something happens, you know, then on your head sort of be it, we're concerned for all our safety. And then by, I think it was 9 o'clock, they sent out the crisis team to assess me, and I asked last night for this interview, and apparently my father-in-law said that they just took one look at me and said, psychosis. I was taken in. I remember walking down into the car, and I was actually quite happy to go. I was hooray, you know, and not even a thought or care for you in. I wasn't aware of any of his needs or anything. I went to hospital, and I spent 3 days there in a sort of catatonic state. I wasn't eating or drinking, and I was on a drip. And then I just sort of, something clicked one morning, and I sort of woke up, and I was dashing around the hospital. My parents and my family were coming in to see me every day, but I didn't know anybody was there. And I sort of gradually sort of improved, and became home after about a week.